Guys, so I have an update on my prior approval form for phalloplasty. I went to another endocrinologist today to get the second form filled out because you need, for bottom surgery, you need two um, licensed doctors um, who are able to diagnose gender dysphoria or something. You need two to sign off on the prior approval form for OHIP funding. So I had my endocrinologist do it, and then I found another one who said he could do it. So I went and had an appointment, met him today. He asked me tons of questions about my transition just to get the gist of it, but it was just simple, whatever. He said, okay, I'll have these filled out and sent to the government by the end of the week, and I should hear back from them within 6 to 8 weeks. Hopefully, I am praying that everything goes well and I get approved and that there's no issues. Because I've been trying to get this done since I think May of this year. So it's been 6 months of trying to get these sent out, and I really, really hope there are no more problems. Yeah. I do have a question. I have two, actually. If anybody happens to know, um, so as far as I'm aware, CAMH, if you go through them, they set up appointments for you. Like they um, contact the surgeon and like do that for you. Maybe I'm wrong, but uh, with the prior approval form, like I'm not going through anybody else. I'm doing this myself, but I'm just going and getting OHIP's approval for funding. So what, do I have to contact the surgeon myself and book consultations and appointments and everything, and then just somehow transfer whatever the government sends me as proof of funding from OHIP, or do they kind of do that for me because they have the name of the surgeon and the place and everything that I'm going to? So do they kind of send that stuff to the surgeon, or do I have to do all of that myself? I'm not sure. There is no information on that. Yeah, if you happen to know the answer to that question, that would be awesome if you could answer in the comments or message me privately. Um, I had another question and I forgot what it is. Oh, yes. Um, Also, if anybody happens to know Dr. Broussard, I feel like I read somewhere that he requires a letter from a psychologist or psychiatrist or something to have surgery with him. Again, if you went through CAMH, you would have already seen psychiatrists and psychologists, and they would have been the ones signing off on saying, yes, you're ready for surgery. I didn't go through CAMH, and I've never seen a psychologist or a psychiatrist or anything like that. Um, so, would it work to have the two doctors that signed off on the OHIP form sign off for surgery, or do I have to go and see a psychologist or psychiatrist? I will ask, like when I call to book consultation or whatever, I will ask them directly, but if anybody happens to know, just so I have a heads up, that would be great. Um, yeah. Also, a little surprise I got in the mail this morning. I was not aware that I was going to be billed for my endocrinologist signing those forms. My family doctor filled out part of the forms, didn't charge me anything. This endocrinologist that I saw today said he was not charging me anything. It's literally checking two boxes and signing the bottom of the form, and I got a bill for $112 from my endocrinologist for that, and I would have paid it anyway, but it would have been nice to have a heads up. Nobody, I've been talking to that, like in contact with them for almost 6 months about these forms, and they're like, yeah, we can fill them out, it'll be no problem, whatever. Nobody bothered to mention to me that it was going to cost me anything. It just really would have been nice to have a heads up because I was not expecting to receive a bill, and especially not for $112. That's kind of my week's paycheck, and I don't know. It just, I wasn't aware that there was a bill, there was a cost for it because nobody said anything. And as far as I can remember, being in that whole office, the many times I've been there, I've never seen any signs anywhere or anything saying that referrals or forms or anything costs anything. Because in most doctors' offices that I've been in where there is a fee, they have it posted like doctor's notes cost $20 or whatever, or forms or referrals cost $30, but I've never seen one there, and they didn't tell me that. So I'm a little disappointed that I wasn't informed in all of these months that I would be paying $112 for him to check 2 boxes and sign something. Um, yeah, so that kind of upset me this morning. Um, yeah, I don't really have the money to be paying for that, so I just left a message saying, in the future, if there's any things that are going to cost me anything, can you give me a heads up before you do anything so that I know, and I will pay you when I have the money, because I don't. Um, yeah, so I wasn't aware that I was going to have to pay for it, so that kind of sucks. Um, yeah, and then my testosterone I picked up today cost more than it usually did, so I just spent a ton of money today on medical stuff, and I'm not really thrilled about it. Um, yeah, but hopefully this will all be approved and everything will be fine. Um, it's been 6 months of trying to get this sent to the government. I'm just ready for things to kind of go well. Also, funny little thing, when I went in, they thought I was male to female instead of FTM. So, because they deal with tons and tons of trans people, and they asked me what my preferred name was, and I was like, I had my name changed like legally years and years ago, so that's the preferred name. And they're like, oh, I think we printed the wrong form, because they have like a form to fill out that's that because usually trans people go there to get hormones, and it's just like a generic trans patient consent form that they have you sign, but there's different for if you're MTF and FTM, because there's different information on them. And they printed the MTF one for me, and she's like, "Oh, does this not apply to you?" And I looked, and I went, "No, other way." And then she's like, "Oh, okay, sorry, I didn't know." So, yeah, that was kind of funny, but yeah. Anyway, I'm just dealing with adult things and learning that I have to pay for tons of things, and I really don't like paying for things. I still need new glasses, which is going to be like $600. But anyway, other than that, my job is going well. I'm really enjoying it. Yeah, it's nice to have a job. It's nice that on a form I had to fill out today that asked me what my occupation was, I actually had something to fill out instead of not applicable. Yeah, so thank you for watching. If you have any questions, comments, video topics, or anything like that, leave them down below or message me. If you have any answers to either of the two questions, please leave them down below in the comments or message me. It would be nice to have a heads up about those things. Yeah, thank you for watching. See ya.